Just as we stated in the previous video on gross anatomy, pectoral girdle is a bony structure that connects the upper limb to the axial skeleton. In this video, we'll focus more on the gross anatomy of the pectoral girdle. It is also known as the shoulder girdle. It is a collection of bones and joints that connects the upper limbs to the axial skeleton, which comprises of the ribs and the sternum. The pectoral girdle provides a stable attachment point for the arms while allowing for a wide range of motion at the shoulder joint. Let's have a look at the things that make up the pectoral girdle. Some of the things that make up the pectoral girdle include the bones, the joints, and spaces. We'll take them one after the other. The bones of the pectoral girdle are mainly the clavicle, also known as the collarbone, and the scapula, which can also be referred as the shoulder blade. The clavicle is a long bone that is S in shape. It articulates with the sternum medially and with the scapula laterally. It transmits forces between the upper limb and the axial skeleton and also keeps the shoulder joint away from the chest wall. The scapula, commonly known as the shoulder blade, is a triangular bone with ridge running along its posterior aspect. This ridge is also known as the spine of the scapula. The scapula articulates with the clavicle laterally and also articulates with the humerus at the glenoid cavity. It does not connect directly to the axial skeleton, but it is indirectly attached through the clavicle and muscle to the rib cage. This allows the scapula to move freely to the back of the thorax, providing a wide range of motion for the shoulder joint. As for the joints of the pectoral girdle, there are 4 in number. They include the sternoclavicular joint, the acromioclavicular joint, the glenohumeral joint, which you can also call the shoulder joint, and the scapulothoracic joint. The sternoclavicular joint is formed by the medial end of the clavicle articulating with the manubrum of the sternum and the first costal cartilage. This joint is saddle-shaped, and because of this, it allows a limited movement like up and down movement, forward and backward movement, and some rotational movement. Acromioclavicular joint is formed between the lateral end of the clavicle and the acromion process of the scapula. This joint is a synovial joint and allows for some gliding movement between the bones. The glenohumeral joint is formed by the articulation between the head of the humerus and the glenoid cavity of the scapula. It is commonly known as the shoulder joint. It is a ball and socket joint allowing for the widest range of movement in the body. Like we also stated in the previous video, the motions carried out by this joint are flexion, extension, abduction, adduction, internal rotation, external rotation, and also circumduction. Finally, the scapulothoracic joint is also another joint of the pectoral girdle. Although it is not a true joint in anatomical sense, it is rather a functional joint where the scapula glides over the posterior surface of the rib cage. The movement of the scapula on the thorax is extremely important for proper shoulder function, most especially during arm elevation. Let us look at the spaces in the pectoral girdle. There are 2 spaces in the pectoral girdle. There is a subacromial space and there is also a scapulothoracic space. The subacromial space is a space between the underside of the acromion process of the scapula and the superior aspect of the humerus. This space contains the tendons of the rotator cuff muscles and the subacromial bursa. Subacromial bursa is simply a fluid-filled sac that cushions the tendon of the rotator cuff, thereby preventing friction. The scapulothoracic space is a space between the scapula and the posterior thoracic wall. It allows the scapula to move freely during shoulder movement. The clinical importance of pectoral girdle is that a good knowledge of pectoral girdle helps healthcare professionals develop target rehabilitation programs for shoulder injuries. Also, a good understanding of the mechanics of shoulder girdle helps athletes improve their throwing, catching, and overall upper body strength. Finally, a thorough understanding of the pectoral girdle anatomy allows healthcare professionals to pinpoint the source of shoulder pain and recommend appropriate treatment. I hope you will find this video helpful and educative. Subscribe and follow this page for more interesting and educating content like this. See you in the next video.